Good evening, everybody, and welcome to this evening's event being hosted by the Northern Ireland Committee of the APM. And we welcome you, and we hope you enjoy the up-and-coming presentation by Matt Wallace. Before we get started, a little bit of housekeeping. Please be aware that the webinar is being recorded and that you are only in listening mode. The session will last approximately about an hour, consist of between around about half an hour to 45 minutes of Matt's presentation, and then we'll have a question and answer session of about 15 to 20 minutes. And on the questions, I would ask you if you're able to submit your questions using the questions box as opposed to the chat box. It just makes it easier for me to pick up the questions that are being asked and only one place to look at. Obviously, remember too that this goes towards your CPD, so that's very important. And the slides will be available after the event on YouTube, etc. So I think that's all the housekeeping done. I would like to welcome Matt Wallace, who is the Director of Estates and Facilities Management for Leicester City Council. Matt has been there in the public service for about 4 years, and previously to that he was a partner in EC Harris, which became Arcadia. He's a quantity surveyor by training, and maybe by project manager by profession at the end of this, and he's more and more welcome. I've known Matt for a number of years because we both served on the RICS Governing Council for our sins, so that's sort of a bit of the background of Matt. So I think without any further ado, I'll hand over to Matt, and I think, having seen the slides this afternoon, I think you'll all find it extremely interesting, a little bit mind-boggling, but certainly it will give you a lot of food for thought as a project manager in the future. Thank you very much, and over to you, Matt.
Thanks, Colin. Much appreciated. Thanks for that great introduction. Good evening, ladies and gentlemen. Hope you're all safe and well. You know what? It was a bit unusual when Colin picked up the phone to me and asked me whether I'd do this. And, I thought to myself what a great opportunity to speak to the Association of Project Managers and talk to you about something. But actually, what about my role as Leicester City Council's lead director for managing the testing programme? What has that got to do? Question the rationale behind actually undertaking that role and applying it to project management. But actually, as a sort of property and construction professional over the last 20 years, there's actually quite an interesting story to tell. So hopefully I won't be boring you over the next 30 or 40 minutes. I'll be giving you a little whistle-stop tour around my experiences of picking up the COVID testing programme for a medium to large city in the UK, and trying to drive it forward and control what's been quite a unique year in terms of the country and in terms of the pandemic and in terms of changing our skill sets. So you can see there, we've got a couple of hashtags. So any of you on the social media, there's a couple of hashtags there to do if you're doing any tweeting, etc., or LinkedIn. Just move the slide on. Does that slide moved on, Colin? Seems to have froze for me. Just one moment.
Yes, it has frozen, I'm afraid, Matt.
There we go. Okay, sorry about that. Okay. So hopefully you can see the next slide. Can we see the next slide? Yep, fantastic. Okay, so yeah, fantastic. You can see there a little, that's me on Twitter at Matt Wallace, and there's me on LinkedIn. You want to catch up with me, got any questions over and above, and we run out of time in the questions. I'll be talking for around 30 minutes to 40 minutes, and as Colin touched on, we're going to be going for about an hour in total, so hopefully I can answer plenty of questions if you've got them as we go through. So we're talking about the Leicester testing programme. We're talking around the challenge of it. We're talking about our approach so far, because obviously the pandemic's not disappeared yet. We're still in lockdown. And then we'll probably touch on a little bit around where we're going next with it as well, what the succession plan looks like, yeah? And then we'll finish off talking around questions, and we'll finish off on that basis. So A little bit about that. Now, Colin's very kindly done a introduction to me, but it was quite right. I had 15 years at EC Harris and Arcadis before 4 years ago, taking the plunge and going back to client side and sort of changing the sort of style of life that I was leading. But it's been a really interesting 4.5 years. And what I can say is that probably in my overall career spanning over 20 years, this is probably my top 5 most complex and interesting projects. Nothing to do with buildings, nothing to do with land, well, a little bit to do with them, I guess, but actually really sort of testing my skills and actually being able to apply some of the project management tools and techniques that we as construction professionals take for granted, actually really help to drive this program forward. So hopefully I'll sort of go into that in a bit more detail as we go through the slide deck. Great stuff. Okay, so as I said, it was the most challenging of projects, and yes, you know, it's in my top 5. It's, you know, in terms of a burning platform, the testing of COVID. I mean, it triggered back nearly a year ago in March the 23rd when Boris called out the national lockdown, 23rd of March. And you know what? Who'd have thought we'd still be in lockdown now? And Leicester was unique, I suppose, in the sense of on the 18th of June, we were the first city in the whole of the UK to be put on an extended restrictions. So pretty much since March the 23rd, Leicester has been in a lockdown or in extended restrictions. So we're unique in that way, and it's been a bone of contention. It's been a source of focus for press and media, and highlighted by our city mayor. And since that date, so that's been a real focus for us. Yeah, been really interesting that it's pretty much an unenviable award that we've had over the last year, and something that we've had to sort of bear with us as we've gone forward. But what it has done as well, it's also been able to demonstrate some of the great work that we've got within the local authority, but also the wider multiple agency and the stakeholders that have been involved in the overall response to COVID. And it's fair to say as well, when I picked up the programme lead for testing on the 18th of June, we were working in like an emergency response, control room environment. So everything was very much hand to mouth. Everything was very much reactive, responsive, and you could maybe say a little bit ad hoc. There's quite a lot of stress in the system because things were being done very urgently, and it's something that, as a project and program manager, was something that I could apply some of the tools and techniques and understanding around program managed offices to maybe change the delivery model going forward. And I'll talk a little bit about that as I go through the slides, but very much one of the challenges that we had. And as I said, it was multi-agency, and I'm sure you've seen on the news, you know, you've got central government, you've got Public Health England, you've got the Department of Health and Social Care, you've got the military involvement, you've got the police, you've got public health in Leicester and Leicestershire, because Leicester is a unitary authority. Leicestershire, we don't see a red line, of course. It's all as one county, I guess. You've got the CCGs, you've got the NHS, lots of different stakeholders into the mix, making things really complex and complicated, and making decisions quite difficult to come to when you've got subject matter experts opining on various different pieces of data. And when you need to move and you need to make decisions, really is important to rely on some of the skills that we get trained as project managers to drive projects forward. Yeah. Another thing on there as well, the sensitivity of communications. As I said before, you know, being the city being longest in lockdown, there's been a real eye opener for us, really, in terms of the international focus that we've had as a city. People coming in asking us what we're doing, actually being at the forefront of ideas that have gone forward, not just on testing, but on the wider vaccinations, etc. Because we've got so much experience around it. Not that we wanted it, of course, but something that we had to sort of adapt to. And actually being able to manage the sensitivities around the press and media has been a challenge in itself. And one of the unique things about Leicester, of course, is its population. It's got a hugely cultural diverse population. In the city centre itself, it's probably 360,000 people in the city centre, probably around 600,000 people when you take in the neighbourhoods. And when we look at maps in a moment when I go through the slides, you'll notice that actually there's probably around 1 million people that have been touched and involved in the extended restrictions around Leicester and the periphery areas that have sort of been impacted by this. So a real eclectic mix of cultures and diversification there. You know, we've got Indians, Asians, Pakistanis, Somalians, West Indians, Eastern Europeans, a real cultural mix, different cultures, different communities that we needed to engage with. And that certainly sort of informed the methodology we took when we started to move into a testing program. So real burning platform. You'll notice a comment there around sticky figures as well. And sticky figures for us means that, you know, Leicester has been number one before, but it's been in the sort of top area for a while in terms of COVID cases when you talk about rates per 100,000 and positivity percentage. But what you've probably found in Leicester, because we've got a mature testing program, we've not actually spiked up and down as much as other areas have, which have gone really high and then dropped really low again. We've sort of kept a bit of a consistency to our numbers, and we call that sticky because the figures are slow to respond. The numbers are slow to respond while the national trend's up and down a little bit. And that's a bit of a challenge to us as well, because actually having a really effective testing program counterintuitively identifies people with COVID, enables them to isolate quick, which is good, but equally the flip side of that is obviously the numbers show that you've got more cases of COVID. So a real burning platform, a real challenge for us going forward that we needed to address. And then I'm just conscious for some reason my slides don't seem to move on, so I have to just move them on manually. There we go. So when we look at Leicester, hopefully you're familiar with it, in the heart of the East Midlands. There we have it, Leicester. The red line that you can see around the plan there is our lockdown area that we had on in June, the extended restrictions. And it's not the red line of the city, it's the actual red line that goes outside of the city. It goes and covers off other areas as well. And that's the sort of extended restriction area. The next slide, it shows a little bit more detail actually around the city, and you can see the red circle to the right hand side northeast of the city is the hot zone, we called it, where high prevalence occurred of COVID right at the beginning of the pandemic, and that was a real hot zone for us in the northeast of the city that was and has continued to be sort of a real difficult area for us to contain. But equally on top of that, outside of the city, you've got other areas. So to the north of the city, the green circle right to the top is Birstall, outside of the city boundary, but it was included within the lockdown area. Excuse me. And to the left, you can see Glenfield, which is part of Blaby District Council. So again, outside of the city perimeter, an area that was brought into the lockdown zone. And then to the south, you can see the big green circle down to the south. That's Oadby and Wigston. Again, if you're looking at figures on the charts, you'll notice that that's sometimes in the high prevalence areas. Again, that got brought into the Leicester sort of urban area in terms of the extended lockdown. And what does that mean? Well, you know what, to Joe Bloggs, it doesn't mean much really. To us in administration, it means quite a bit, because the red line administration changes. A lot of the decisions made around COVID is made by the Director of Public Health, which for Leicester City Council is a guy called Ivan Brown. Great guy, but he's got no jurisdiction in Charnwood, he's got no jurisdiction in Blaby, and he's got no jurisdiction in Oadby and Wigston. The person who's got jurisdiction there is the Director of Public Health for Leicestershire County Council, Mike Sands. So there's another complexity around stakeholders and having to engage with counties as well as cities as we went forward, and really understanding our stakeholders, which I'm sure all of you project managers listening to this will have empathy and understand the importance of stakeholder mapping, getting a real tight directive of who the communication plans are going to right at the beginning of a project. Okay, so in terms of our approach, what do we do? Well, first and foremost, it was for me recognizing that, you know what, I'm not a public health expert, I'm not an epidemiologist, but what I can do is apply my project management skills, tools, techniques, my learning to drive a program of work forward. So it's really recognising the epidemiology and health expertise absolutely needs to drive the testing strategy forward. So they were fundamental in driving the testing strategy forward. But as subject matter experts, what I needed to do was very quickly change the governance model, move it from this emergency control room situation into more of a programmatic approach, something that we could manage better, something that we could resource around, be more strategic, so we could program things out and actually really focus on delivering high numbers of tests across a large area on a day-by-day basis, but equally remain really agile, so we can move if needs be, if the data told us to go and test a different area. So really important that we got that understanding. So yeah, absolutely. I'll talk about some of the tools and techniques that I've used, some of the technology that we've got in place, which really helped us support us deliver the testing program, and it still is today. And then a little bit around the capacity and capability that we put into place to ensure that we could deliver the high numbers that we did in terms of testing. Just so people are aware, Leicester is in the top two areas in the whole of the country in terms of testing. We were by far the largest until Liverpool did theirs, and they slightly increased over ours. We've probably done around 170,000 PCR tests, which is the laboratory test, and we're now doing tens of thousands of lateral flow, which is the rapid test every day for the city. Really mature numbers in terms of that. So absolutely around creating an operational coordination centre as well. So really important for us to utilise some of the estate that I've got in my day job as Director of Estates. A lot of my buildings have been closed due to the pandemic, including leisure centres. So utilising somewhere like Ayleston Leisure Centre as my coordination hub, absolutely vital facility for us. Really important to be able to have that ability to do that sort of thing. So that was really good. So all about applying a systematic approach, assigning and deploying resource to where we needed it most to deliver what we needed to do. Let me see if it worked. There we go, it's working again now. Great stuff. So one of the first things we needed to do was to divide and conquer the city. So absolutely understand where those 600,000 to 1 million people sat and resided in the city and then outside the city, so we could go on and check whether where the COVID outbreaks were and really focus on certain areas. And you'll hear me talk around medium super output areas, MSOAs, and local super output areas. There's a lot of people in the city actually working at local super output areas, around 2,000, 2,500 people. Really important that we can focus that sort of detail around this area. And what do we use? Well, we've got a GIS mapping system that I'll talk about in a moment, but real important bit of kit. You can see an image there outlining the local super output areas. So we've got around 260 of those, if you care to count them. Lots of different areas. You'll see some are larger than others, but rough and tough, they're probably around 2,000 to 2,500 people in each of those areas. Gives us some real focused numbers in terms of being able to focus on where the prevalence of the outbreaks are, where the chimney pots are as well. So that's the sort of local super output areas that we work on. And one of the other most important things that we did, and one of the first things I did, was move it to a program managed office environment. So moving away from the control room, emergency control room scenario and that area, moving into a program managed office, which is something which as project managers are probably used to, but it also gives us a huge ability to be able to manage resource, enable subject matter experts to opine and do what they need to do, but not to slow down the mechanism. Also enables us to plan capability and capacity really well. Now I'm going to jump through these slides because I just think they'll be there available for everybody at the end, but it just shows a bit of a development really in terms of the testing program in June 2020. It changes, like the pandemic's changed. You could see there was an epi-cell and there was a testing cell, and that fed into an IMT, an incident management meeting, and that in turn fed into the different organisational structure of the way that I tested the city, an omni-channel testing based on the sort of key focus group areas. And then you can say it changed in November, where we moved from having two, an epicell and a testing cell team, to an outbreak cell as well. So that was an outbreak cell meeting where really did focus with the epidemiologists around where those outbreaks were occurring, which LSOA areas the outbreaks were occurring in. And that sort of intelligence gave us the ability to be able to determine whether our forward look for the next few days of where we were going to focus our resource to go out and test the people in those areas, because it's really important to test those people, isolate cases of COVID, and then stop it spreading. We could do that really quickly, under 24 hours, off the back of having the outbreak cell meetings informing us in there. And just below the green boxes, you'll see City Reach, which was an adaptation of when initially back in June the military were involved doing an in-reach program into our local communities. When they moved out around November time, the council were really keen to continue to connect with our local communities, because we knew the door knocking regime that we've got, with around 500 volunteers a day deployed into our local communities, was a really successful method of getting tests out to people, those people that are most vulnerable, those communities that not necessarily understand English as well as Middle England would, those sort of communities that would really benefit from it. And that City Reach program has been one of the huge successes of our testing program, and probably one of the reasons why we really have got to the heart and the nub of some of the challenges that we've faced. And just there you can see the testing program as it sits in December. Again, it's got the three cell meetings of the outbreak, the epidemiology cell and the testing cell meeting. But in addition to that, you'll notice in the pillar 2 area of testing, we've got rapid test centres. So these are the lateral flow device test centres, those tests that we can get done and the results come out within half an hour. And that was a really important addition to our testing offer in the city. Happened just before Christmas. And we've now got 6 of those rapid test centres across the city, and I'm sure you're aware that they're rolling out with schools now. Local businesses can do that, so a really important additional strand to the testing programme that was added in. At the top of that slide as well, you can see the different partners around involved in it. Leicestershire County Council as well as the City Council. As I said, this certainly did span outside of the city boundary. So, in terms of the testing program itself, it was clear that I needed to set it into different levels and organise it. So typically it was around strategic, it was around tactical organisation, and then an operational side. And that gave me a real common platform really to build from and sort of enable succession planning to occur from as well. I mean, it's not for me to read it. The governance and operating model of a PMO is very agile. It gives ownership throughout, so different people have got ownership of their various work strands. It's underpinned by governance controls, which, you know, we're probably all familiar with project execution plans. Yes, I rolled out a project execution plan for this, and it actually worked in practice really well. Well received by the military, well received by the DHSC. These things do work outside of construction projects, as you're probably well aware. And we did things like daily situation report meetings, changing and moving them around, adjusted the timing of it to enable us to be more front facing rather than constantly in meetings talking to ourselves. And we also really established strong links to feed information through to those directors of public health, those decision makers in the city and in the county, so they could make informed decisions on where we would deploy our resources. In essence, what we're talking about there is data-driven decisions, you know, fed down through the IMT meetings from the testing cell operational project team. And as it said on the kicker there, it's a systematic approach to assigning and deploying resources. There's a classic operational project team organogram there. You can see the strategic, tactical, operational levels that we work to. Myself and as program director with support from Lorna, who's been superb through the program. To the right of me is the strategic knowledge group, and that's the reason I've kept it in really, in terms of one of the key challenges that I had when I came into the program was, you know, the epidemiologists and health sector experts are absolutely that. But the problem that you've got when they're all in a room and there's a lot of stakeholders is decisions are difficult to come by, because we're talking about a virus that people don't know all the detail of. We're talking about something that's opinion. A lot of people with a lot of opinions and a lot of intelligence around epidemiology information, which sort of informs the way forward. And it was important for me that we kept them to one side so they could do their thought leadership, they could do their strategic focus and discussions, but they didn't fetter the operational performance of the program managed office. You know, at its height, we had around 1,000 people, 600 volunteers, 400 redeployed staff a day working on this program. And, you know, we didn't have the time or resource to be waiting for people to make decisions. We knew we needed to be out on the doorsteps, and we just needed to know which LSOAs we needed to get to. And sometimes we needed to drive that through project management tools and techniques, through making decisions on behalf of that strategic knowledge group. So you can see there some of the stakeholders in the strategic knowledge group, some real important stakeholders: CCG, British Army, the LRF, which is the local resilience forum led by Leicestershire Constabulary, the police themselves, Public Health England. Need to go on. There's a lot of different people in that strategic knowledge group, and also the control room as well, because we could still draw on an emergency control room should an outbreak occur in a specific area of the city, and we really needed to focus our efforts around that as a separate operation. So really interesting to see that model come to fruition. Okay, so the project execution plan. We know all about these, don't we? And I don't really want to go into an amazing amount of detail around this, but like your standard project execution plan, really important for us to get that in place. Defines what we were doing in terms of a project, gave everybody a set of objectives, and outlined how we were going to organise everything from your project directory to the risks associated with it, to the different processes that we needed to follow. And it gave us that common platform to build off. Really was a useful exercise and a useful document that we still lean on today, actually, in terms of going forward. Interestingly enough, because we were the first into an extended lockdown period, we also know that this has been utilised by other local authorities as well in their areas. So really important bit of project management tools that we could use going forward. Yeah. So what's this all about? One version of the testing plan. Well, really important for us, as I said, massive sensitivity around the press and media and the focus around this project and around the testing programme and around COVID in general in Leicester. And so it was important for us to be able to manage and control and be able to communicate what we were doing, so it was clear and concise in a real complex world. Actually, by using these different channels of testing, it was really important that we could be clear through our social media platforms, through our press and media coverage of what we were doing and where. And so what we created was, and my senior QS actually did this, was just a forward look program. So it was a 9-day forward look that we updated every single day, and it just basically went through the omni-channel approach to testing that we took. So there was, you can see there was three MTUs, mobile testing units. There was 5 local test centres, which are also called hyperlocals, that we use. You can see when they're open. You can see the county sites. Moving down through the sheet, you can see the regional test site at Birstall Park and Ride, and you can see the lateral flow sites as well. There's 6 of those, and when they're open, which is pretty much open all the time. And then moving down into what we call the LSOAs in the City Reach plan, you can see the 3 LSOA areas that we target every single day with our resource to go off and deliver that as well. And true to form, you can see as we go down there, you can see at the bottom a little resource stack. So this is at that present moment in time that we're running at the moment. I think this is a week or 2 old. You can see that we've got about 175 people working on the programme, predominantly on the lateral flow testing sites, but we've got 35 people on community doorstep advising, 7 care home based, regulatory services 10, etc., etc. So you can see our resource stack and where we're deploying our resource. It's really important that we kept that up to date our press and media could utilise it, identify, notify local imams, local community groups, people when we're going into their areas, knocking on those doors, and that really improved the success rate in terms of people opening their door, taking away a home test kit and testing themselves for the virus. And this is what happened every night. So LSOA mapping areas every evening when we got back. The team would go through that, they'd go through the maps, they'd agree what they'd completed and where they'd got to in terms of the properties, and then they'd go off and they'd get MTU tasking sheets back, and they'd go off the next day and use these. So really important that we utilise these sheets, they were up to date. People would have them handed out at the coordination centre at Ayleston. They'd have an IPC, which is an infection prevention control person, give them a briefing every morning. They go off a minibus and then they'll go and do their door knocking, utilising these testing sheets. So really important that we could do that and update as we went through, and also be really responsive in case those LSOA areas changed. Another absolute game changer for us was being able to sort of work across a whole GIS system, and we've got Aurora in our local authority, which provided fantastic web-based platform for us to do this. You can see there, and I'm not going to read everything off the slides because it will take a bit too long, and I know I'm running tight on time, but you can see there the wards. So at ward level, we can cover off the various wards across the city, which is great, really useful, especially when we're utilising our ward councillors and politicians to get announcements out. But then you can see how we drop down to sort of move down to further layers, and you can see the different sort of layers that we can go into, switching, showcasing LSOA areas. Just take a quick drink, sorry. COVID case data, domestic properties, the testing sites that we've got, so some of the Leicester City Council's community facilities. So really, really useful data that we can use on this. And then you can zoom in even further, you know, into the LSOA area, find further information about that specific LSOA, how many populations in there, etc., how many people tested positive in that area. Really useful functionality to the Aurora system. And then you can put in bespoke queries as well, i.e. find the nearest test centre to this specific LSOA area. So real good functionality in there that you could use, and we used on a daily basis to really inform our testing programme in real time of what we needed to do. And what you can see there is the pink dots on there are chimney pots. So really good indication of how many houses are in that local area, how many houses, how many streets can we get through in that particular LSOA during a given day. Gives us real intelligence around what we're doing. And you can see it all on community facilities as well. So Aurora is a fantastic bit of equipment, really useful. Didn't think we could utilise it for a programme like the COVID testing programme, but absolutely became a fundamental pillar of what we were doing, and actually part of our success that we could utilise it going forward. Okay, and another thing that's really important to us as well was how we presented the data. So really important to get the right team involved, the right people around it, and we had some of our best IT gurus, some of the construction professionals like my QSs who are really good on databases and spreadsheets to present the data for us. So we had testing program there. You can see, what was it, back in September, 154k cumulative tests undertaken in terms of PCR tests. And then we've got real important dashboard demographics that give indicators around how things are performing across medium super output areas, across LSOA areas, and also across different demographics. So real powerful power sort of BI information that enables us to see real strong reporting going forward. So really did support us when we're going forward and providing reports to underpin the great work that's going on with the rest of the teams. And you can see there sort of simple diagrams indicating where the prevalence is of positive tests by week, etc. So in terms of the testing program, in terms of the summary, you know, codifying the program, our program approach, that's absolutely what we were doing. It enabled us to gain control and ownership of the program as well, with all the different stakeholders involved, DHSC, Public Health England, the military, etc. It was important that the council took control and public health within Leicester City were able to take ownership, because long term it's going to become part of our DNA going forward and business as usual. What it also did was provide clear reporting for multiple stakeholders and interested parties, and also towards the press and the media, to enable us to get that channel out there to support us rather than work against us, really, in what we're trying to achieve, which worked really successfully. And it absolutely facilitated multi-agency collaboration. It also helped us continue with the longer term testing program as well, which is what it's all about. It was a pragmatic approach, deliver at pace across multiple work streams. And then we look towards where we go next, the succession plan. What happens to me? Well, actually, I'm going through a transition now. I'm actually transitioning myself out of the testing program now. As we move back into business as usual, I need to go back to buying land, selling land, building things, managing the largest estate in the city. As the biggest landowner, there's a lot of my day job I need to go back to. I'll still be inextricably linked to the program, but I do need to start vacating myself out. So there's a succession plan in place for me to go back to my day job. Vaccinations continue at pace, don't they? Across Leicester, we've got probably 80% plus now of our over 70s vaccinated. The rest of the population are following suit. Real putting confidence into the system that hopefully we can follow Boris's 4-step program. I'm not going to talk about June dates, etc., on those steps, but definitely heading in the right direction, even for Leicester, which is high in the stakes in terms of our rate per 100,000, our percentage positivity. But they will be dropping. They are dropping. I'm confident that given time, a new normal way of life will emerge, and testing will be part of it. And the way we test will be done differently in new ways. So actually, as you could see previously, around 1,000 people a day last year were being deployed on this program, on the testing program. Now we're down at 175 people a day. And actually, as we move and mature the model, it will change again. And as we become more to business as usual. And actually, one of the benefits that we've utilised as well is our smart cities team. People who are looking to research and development and data and technology as a city moving forward. And actually what they've done as well is they've been able to inform us around where the testing program can go next. How can we, with less resource, focus our efforts around testing going forward? And I'm sure you'll all agree the rapid testing is a really convenient way of quickly identifying whether you've got COVID or not. And one of the benefits of doing that is being able to focus your resource around it. So we're currently in conversations with technology companies around being able to focus our using mobile-based analytics to inform our testing strategy. So utilising less resource, but actually using technology that's in our pockets to be able to identify different demographics where people might congregate, where footfall might occur, and then we'll mobilise testing units to support and hit those areas so we can increase our testing rate in those focused areas. Really using the power of technology as our next step moving forward, and that's where we're looking at as we go forward into the future. And as you can see there, sort of driving decision making through Vodafone network data insights. So really utilising technology to move forward, so we can really understand our demographic of the city, where the prevalence is occurring, and then focus our efforts to make sure that we test and isolate those specific areas. Great stuff. So in summary, what can I say? It was around, in its prime, it was around 1,000 people a day deployed on the testing program. You know what? The construction PM skills, absolutely cross-transferable in a situation like this. One of the most important things for me was understanding that burning platform right at the beginning, those challenges, understanding the scale and the pace that we needed to work for, and identify the resource required to deliver and get support, which we did from the Mayor, from the Director of Public Health to deploy that resource. And then actually just some strong leadership. So strong leadership, governance in place, and then enjoyed being part of that solution, enjoyed being part of the journey and driving the motivation and commitment to keep getting that 1,000 people a day out on the doorsteps, putting themselves in front of people and making sure that as a city we move forward and protect each other as a community. Yeah. And then equally as important is getting to that position where we create succession plans and craft an eloquent exit so we can move forward and people can get back to business as usual. And you know what, it's sort of summarising around it, as project managers, we can all add value in various settings. And that's one of the summaries that I really sort of come out of moving through this programme is, as I'm exiting it, I've made a whole host of new friends. I now know epidemiologists, public health experts, doctors, people from the military that I'd never have got to meet during my normal construction projects or my normal land acquisitions transactions. So it's been great in terms of a life experience. And you know, out of all the bad and sadness that's come through this pandemic, these are the things that enable us to sort of get value from it in understanding that actually our skills do make a difference, and you can make a difference across the piece. Okay, I'm conscious. What was that? About 40 minutes. Great stuff. I'm happy to take questions. Colin.
Yeah, we've got a few coming in here. I'll kick off with one from David. Out of having come from a construction background, Matt, what do you think are probably the one or two of the main skills that you're able to transfer over into this uncharted waters at the very beginning?
Yeah, no, that's a great question, David. So I suppose leadership and project management qualities are super important. I guess when I first started back in June reflecting on it, I think probably calmness under pressure is really important. You've got multiple stakeholders, you've got people that have got a bit of fatigue actually because they've been going through a process and they've been, there's quite a lot of stress in the system. So being calm under pressure, being rational, being considered, being pragmatic, a little bit of agree a plan and then follow the plan that you've agreed. Communications is obviously really important, having strong communications and working across multiple stakeholders, which is something that us as project managers are well accustomed to. Really important skills, but also that focus on agility. So by that I mean, as project managers, we're used to change control being a mechanism within the contracts that we deliver. Yeah. So having a change control procedure in place sits in the PEP. People understand it, know it, but having that in there gives us the ability to be calm under pressure, because if an outbreak occurs, we have to change the LSOA areas we're focused on one day. We can do that in a structured change control manner, and it deflates some of the pressure that goes through the system. So I'll probably say they're probably some of the skill sets that are sort of transferable.
Yeah, I've got a double-barreled question from our chairman, Catherine. The first one is, how did you get this task? Was it by choice or nominated? And secondly, follow up to that, which I'm sure you wanted to run a mile, mind you, whenever they came to you. The second part of her question is, what was the funding source and how was it all budgeted?
Yeah, it's great questions. Great questions. So a little bit of both, if I'm being honest. The answer to the first question. So because I run the whole estate, one of the actions that I was undertaking at the time, from March the 23rd, was actually making our properties COVID secure. So as people work from home, I was working closely with the Director of Public Health to make sure our assets were COVID secure. And as we were setting up certain test centres, I noticed there was a bit of distress within the system because we had a lot of stakeholders coming in, with the military coming in, and they were looking to take hold of certain properties. And I could see some stress in the system. So actually I disrupted the system, if I'm being honest. I stepped in there and spoke to my Director of Public Health and said, look, I think there's different methodologies we can apply here to help the system flow a little better.
Yep. So
be careful what you wish for is probably the sort of edict around that, because in essence it was a case of, oh, fair enough, Matt, do you mind heading up the testing program and taking it forward. So nominated a little bit by choice as well. But what I would say is the team that I had around it were fantastic. So the medics, the epidemiologists, as well as the project team that I lifted and shifted from a construction-related background, have been fantastic. Really dedicated members of staff. The second part of the question, what was it? Funding sources.
Source of funding and the budget. Yeah.
So working closely with DHSC, they have committed funding to us of different types. There's various forms that we have to fill out. There's standing operating procedures for each of the different testing methodologies that we have to agree to. Providing we can confirm we've adhered to those testing procedures, we'll get refunded for certain types of test and we'll get reimbursed the funds. Hand on heart, I can't say that we've been reimbursed all the money as of yet. We've had to take it out of the budgets, but we're confident we will get the money back. Early indications are that the government have been more than reasonable around that aspect of it. Interesting fact, for instance, we get around £14 per lateral flow device test. So somebody like me who comes into the office on regular occasions because I'm an essential worker, I get tested twice a week. I go down and get lateral flow test twice a week. The City Council gets £14 each time I get a test, just as a funding. So you can see the metrics when you're getting tens of thousands of these. The numbers add up. Good questions, though, Catherine.
Yeah. Another question here from Igor, which is very interesting too, actually, in that how did you evaluate the feedback from citizens on a day-to-day communications push to them? Obviously, you're dealing with a lot of different communities, and how was that sort of assimilated, and also taking into that their educational backgrounds and their familiarity with technology? How is that helping to focus on the actions on containing the spread of the virus?
Yeah, I mean, it's one of the areas which, instead of just having a comms and media channel around the sort of work streams, we also had a community engagement channel. Benefited hugely from a mature volunteer group. So we have over 500 volunteers already enabled, and we redeployed them onto the testing program, which was really important because a lot of these people were used to communicating in the various different communities. And because we had that mature model, we could speak to a community group. Really, we've got the established links with community groups, with local imams, with local mosques. And one of the important parts of this is to speak their language, to empathise with the challenges they've got, whatever it might be, or whatever the, myth bust the different things that are going around. But there's so many different channels. So we'd put it out on social media, we'd do letter drops, we'd do the door knocks, we'd return the next day, we'd do leaflets, we'd have translators with us, so we'd have translators as well. And we'd also respond to feedback. So we'd receive feedback through various different channels. It'd go back either through the community group channel, or it'd go back through our comms channel. And then we would look at it through the IMT process, which is twice a week, and we'd determine what changes or alterations we'd need to do. But it is a big challenge, and quite right. We've got technology. We had handheld devices out in the field, but sometimes they weren't of use for certain people. So we'd have to go to long-handed pen and paper type approaches to a number of different aspects. Register tests for people, literally. At the end of the day, it was, sometimes you just have to roll your sleeves up and adapt processes to make it happen. Great question.
Good. I've got one from Jackie here, which I must admit I was wondering too. How did you resource up to 1,000 people at the very beginning, and how might this challenge you in the future when the virus begins to recover? So you obviously didn't have them all sitting there waiting to be brought in to start doing the work.
Yeah, so actually 500 of them were volunteers. So 500 were volunteers, so pretty much really mature volunteer group within the local authority that we could call on very quickly. And so that gave us a committed resource very quickly. In addition to that, and depending on the different journey of the lockdowns, because the restrictions changed, we had a lot of redeployed staff as well. So around 15,000, employ of around 15,000 people in total. Not all of our people could go back to work. Libraries were shut, sports, leisure facilities were shut. Large swathes of our resource were at home and weren't doing much. So to be able to work carefully with our HR colleagues and redeploy staff, and actually shows the commitment and dedication of the Leicester City Council employees to actually put their head above the parapet and say, you know what, I can't do my day job because the leisure centre is shut, because the library is shut or whatever, but what I can do is go and help the pandemic, our response to the pandemic. It's great credit to those people.
Yeah, just a follow up from myself on that, Matt. But obviously you had to then have a training regime for those people who are coming from totally different backgrounds, and how was that set up to be very quickly implemented?
Yeah, so I touched on it a couple of times when I talked. Was Ayleston Leisure Centre, we took that over as our coordination centre. Mm-hmm. Enormous dry side leisure facility, so we could socially distance groups of people that could go in and get trained. Every morning we'd have infection prevention control officer going through and repeating the safe systems of work that we do when we're out in the field to make sure they're all COVID secure, got all the PPE, all the safe systems of work in place, and we basically go through the same set processes to make sure everything followed strict guidelines that Public Health England and DHSC had given us in terms of COVID secure practices. So basically following their guidelines.
Right, okay. Liberty's got a really good question here. We know what went well, what didn't go well. Any highlights?
I'll tell you what, there's loads, and I don't think I had quite so many grey hairs this time last year, I must be brutally honest. But the pressure points that you get around these things are phenomenal, actually, and there's nothing more challenging than when you've got multiple agencies working together, all wanting the best thing, but kind of pulling in different directions. And I think definitely some of the pressures that we felt maybe midpoint last year, late last year, where we were running low on test kits.
Yeah.
So you can imagine this hungry machine of 1,000 people a day knocking on doors, distributing test kits out. We were using a lot of tests every week, thousands of test kits every week. And there were certain times where the machine that was set up, so picking up tests to take them to the laboratory, dropping off the test results back, all this sort of thing, it didn't go to plan. And it sounds really small fry, but actually if you've got a couple of thousand tests sitting in a leisure centre waiting for a courier to pick them up to take them to the lab, and the courier doesn't turn up, you don't need that to happen too often before you've got a real pressure point going on. And equally, because the machine just keeps running and you're stockpiling things, and it's quite a stressful scenario. In addition to that, when you're running really low on tests, so you've got this big hungry machine handing test kits out, and we got down to our last couple of 100 kits during the back end of last year. Really quite stressful. Lots of phone calls with me onto senior officials from DHSC, etc. Escalated to the mayor, escalated to the director of public health. You know what? They all come good in the end, but there was a lot of stress. There's a lot of stress in that.
Yeah, a very good question for Ash, and hopefully you'll be able to give him give some guidance on it. I am studying project manager, and I want to gain some experience. So what kind of experience should I look for in order to develop my project management career?
You know what, whether it's widgets or whether it's testing programs or whether it's a construction project, anything that you've got the metrics of time, cost, quality performance and risk, and you're not going to be a million miles out, And look, you might be making widgets in a factory. It might not be a construction project, which you might want to ultimately get to. But I think the important thing is getting into those good habits of, setting up strong governance mechanisms and then deploying them strong governance mechanisms. And then, I've seen project managers that have maybe been on the tools like you or I, Colin, gone through a building surveying QS background and gravitated into project management, and then and that have been brilliant, by the way. And I've equally seen ones that have been not so good. Equally saying that, I've seen non-vocational project managers come in from a completely different mindset and be brilliant as well. So, and that's probably one of my key things is, whilst it's great to have a lot of strong methodologies, you've got to keep your personality within the project manager as well. So always put your own personality on there, because at the end of the day, we're all human beings. The technology that we use, the tools and techniques that we use are fantastic and help us do our day job. But, whether it's virtual like we're doing this evening, or whether it's around a table, which hopefully we'll be doing more of in the future, eye to eye, face to face contact, dealing with human beings is where we add value, and you can't mechanize that kind of thing, that sort of opinion. So yeah, I wish you luck with your studying. I'm not sure whether I've answered it great, but if you get a construction project and can support a project manager on that, there's nothing better, I guess. But I appreciate that times are difficult at the moment.
Yeah, we've got a question, probably just nearly our final question from John, and what he was asking was in terms of lessons learned. And you mentioned about Liverpool and other cities that are have been carrying out certain rate testing regimes. Has there been a sort of a coordination between various other local authorities, or even other general authorities, that you've been able to pass on your learning or gain learning from others?
Yeah, and we spoke to Liverpool, and we've both learned from the different methodologies that we've taken. And you'll see when we talk about the omni-channel approach to testing, some of the methodologies, the mobile testing units, the local test centres, really good. Mm-hmm. But honestly, I would say that one of the unique selling points, one of the most important things, which I think, heaven forbid we never go down this route again, but the city reach, going into your local communities, having resource to go into door by door approach is by far the best method to actually get into your communities. But it takes a huge amount of resource. It takes a huge amount of effort. People who speak the lingo, people who are empathetic to those community groups. There's a huge amount of effort that goes into that element. But that is the differentiator, I would say, to actually, the lesson learned for me would definitely be, whilst it's challenging, it's really difficult, if you really want to get to the heart of the problem and really isolate it, you've got to break down those cultures, and you've got to go into the communities and go to the people, because people will not necessarily get in the car and drive to somewhere or walk to somewhere to do this sort of thing. We've got to go to them.
Yeah, that's great. Well, unfortunately, our hour is up. Our questions are finished. If you have any other questions that you would like for Matt to answer, I'm sure you'll be able to challenge them through either his contacts that you gave at the beginning, or even through APM. But on behalf of everybody, Matt, from not only from Northern Ireland but across the country, because we had a wide range of sources of members. Thank you very much. It was illuminating, would not be the word, I don't think, but it was certainly a challenge that you obviously rose and met and succeeded. And I think on behalf of everybody, would thank you for your time. Thanks for the presentation. It was really interesting, and we wish you well getting back to bricks and mortar and acres of fields in the next. And also on behalf of everybody in the branch, I'd like to thank the APM administration for keeping us on the straight and narrow and helping Matt and myself to get this out to you all. And I think that really concludes the evening. Keep your eyes open for future events on the APM website. There's lots of interesting ones coming up, and the rest of, hope everybody keeps safe and enjoy yourself. It'll soon be Easter, and we might get a bit of a holiday, you never know. So thanks again. fingers crossed, and look after yourselves, and good night. Bye-bye.
Stay safe, everyone. Bye now.